Okay, good morning. This is going to be tape 4, lectures 7 and 8 in the abnormal psychology. I'm going to start out this morning talking a little bit about research methods as they might be applied in studies relevant to psychopathology. I'm going to talk about 4 kinds of studies: correlational methods, experimental methods, case studies, and single subject designs. Correlational methods are those where you are studying or observing relationships between variables as they are occurring in nature. You're looking at two things, two measures, two variables to see if one predicts another. And what is the strength of the relationship between one variable and another. An example might be predicting a child's intelligence from parents' intelligence. There's going to be a relationship. Brighter parents are likely to have brighter children, but it's not going to be a perfect correlation. You'll be able to predict within a certain range of what the child's intelligence would be likely to be. Another might be predicting level of depression or anxiety based on level of stress. Again, if you had a stress measure and you have an anxiety or a depression measure, you can relate them, and one may be predictive of the other, but it's likely to be imperfect. And the issue that I'll talk about a little bit more in a minute is that one thing about correlational methods is that we typically don't know whether if A and B are related, we don't know necessarily that A causes B. It could be that B causes A, and it could be that C causes both A and B to be related. This is just an example of anxiety and depression might be related, such that the higher you are on the anxiety scale over here, the higher you are also on the depression scale. Now, if you were actually measuring a bunch of people, what you'd have would be a series of points that would be sort of all around this line. The line would be your prediction line, but you'd be predicting only within some margin of error. And the index of the strength of the correlation, the accuracy of the prediction, is a correlation coefficient. And if actually everybody lined up exactly on that line and you could predict one score perfectly from the other, that would be a +1 correlation. If there was no relationship, if the points on this graph were randomly distributed all over the place, and you couldn't predict score on one test from the other, that would be a 0 correlation. And something like this is a measure of resilience and a measure of depression. You'd be likely to get a negative correlation where high score on one would predict a low score on the other. And again, the major point here is that if we found that anxiety and depression were related, we wouldn't know whether anxiety causes depression, depression causes anxiety, or some third variable like stress cause both anxiety and depression. Correlation is not causation. This is a logical error that you often see made. If one variable is related to another, people assume that they can conclude that one thing causes the other. A good example of an actual type of research question is whether or not smoking causes cancer. Now, what we'd like to do is be able to say, okay, you people over here smoke for 30 years, and we're going to see if you have more cancer than you people over here who are not going to smoke for 30 years. We can't do that. That would be an experimental method that I'll talk about next. But we can look at various kinds of correlational evidence. Do people who smoke have higher rates of cancer than people who don't? Well, yes. is the length of time that you've smoked related to the your probability of having cancer? Well, yes. Is the number of cigarettes that you smoke related, etc.? You can start to essentially eliminate alternative explanations, and it becomes very difficult to argue anything but smoking causes cancer. But with any particular single correlation, you can't prove the causality. Experimental methods are an attempt to be able to demonstrate causality. Here you have an independent variable and a dependent variable. The dependent variable is the thing that you want to measure as the possible effect, and you're going to independently set the value of the independent variable. So it's independent of nature. You are determining the independent. And again, if I could randomly assign people to be smokers or non-smokers, that would be an independent variable because of the random assignment. And random assignment is a major feature of experimental methods. If you're going to have two different conditions, you want to be sure that you randomly assign people. That way, it isn't something about the group of people. If I were to take one class and give them whatever measure and another class, I didn't randomly assign people to classes. So it could be that people who are in afternoon classes are slightly different than people who are in morning classes in terms of their personality or something like that. So that would be correlational. That wouldn't be an experimental method. And control conditions are another hallmark of this method, where you give your experimental manipulation to one group and then you don't give it to the other group and hold that group as a control. This is an experiment that I made up the data for just to illustrate this. And here what you have is you randomly assign people to one of three groups. They either get the new antidepressant medication, the drug, or they get psychotherapy for their depression, or they get a placebo pill. And if at the pretest all three of these groups started out at roughly the same level, then at the post-test, the people who received the placebo improved somewhat, but not as much as the people who are in either of the other two conditions. Then we follow them up for 3 months after the completion of the intervention trial. The people who got the placebo have gotten, on the average, their scores are a little bit higher. So are the scores for the other two, but they're still doing better than those who got the placebo. And if we look at the 12-month follow-up, in my study, the psychotherapy people ended up doing better than the medication people who are close to the placebo people. So again, what you're doing is looking at the random assignment to one of three conditions and then following them across time. And technically what you're doing is ruling out other variables. You're ruling out the fact that it might be a different group of people by doing the random assignment. So you're isolating the drug versus placebo versus psychotherapy as the probable cause of the differences between the three groups at that point. And treatment outcome is where this kind of design is most frequently seen in psychopathology. And these are just a whole bunch of different designs. A drug versus placebo is the standard kind of a test for a medication or for a psychotherapy You have placebo psychotherapies, just relaxation exercises or something like that. Then people do studies of psychotherapy versus placebo psychotherapy, drugs versus psychotherapy versus placebo, drug psychotherapy, their combination and a placebo. People do studies of dose level, small dose of the drug versus a large dose of the drug, or low number of sessions versus a higher number of sessions. I've even seen studies of light therapy, which we'll talk about later, a bright light that's used for bipolar or seasonal affective disorder, and people have done dose studies of the brightness of the light to see if that makes a difference in improvement of seasonal affective disorder. Comparisons to standard treatment. You have a new treatment, and you might want to compare it to a tried and true standard treatment. And then there are disassembly studies. Most therapy packages are packages. They're multiple parts of an intervention. You teach people certain ideas and you give them homework, etc. And you might want to disassemble that with or without homework condition, for example, to find out what's the contribution of the different components of the larger treatment package. Now, here's another experiment that I made up. Told you earlier about the Stroop test, where you're asked to identify the color that words are written in when the words are red, green, blue, etc., and the nature of what's written interferes with naming the color. Well, I'm making up an experiment here where I've got depressed people, anxious people, and normals, and I'm giving them the regular Stroop test. On the regular Stroop test, they all make a few errors, but then I introduce some anxiety words in there, and the anxious subjects make the most errors, and then I introduce some depressed words, and the depressed subjects make the most errors. Now, the question is this an experiment? And yes, it would be an experiment if I induced depression and anxiety. If I had some people, if I randomly assigned people to listen to a depressing tape and got them into a sad mood, or had them listen, say, to an anxious tape of some sort and got into an anxious mood, then it would be an experiment. But if these were patients who I chose because they scored high, or because they were diagnosed with depression or an anxiety disorder, and ran them in the condition, then it would actually be correlational, because I would be simply looking at the correlation between the error scores for 3 different types of people. So sometimes things that look like experiments actually are correlational. You can do an intervention and manipulate a variable, but if you're doing it for different groups of people, it's really a correlational kind of study. Case studies. Case studies are intensive studies of individuals. They're done when usually when it's a rare or unusual kind of case, and the person is studied in great detail. Case studies have the possibilities of hypothesis generating. You can't really prove a cause or whatever, but you may generate ideas about the nature of cause and effect relationships. You could potentially disprove some hypothesis if you found if your theory was that all cases of this disorder were caused by childhood abuse, and you found one case, then you studied intensively and found that there was no childhood abuse, you might disprove a hypothesis, but you can't really prove it. And there are famous cases like this. There's the 3 Faces of Eve case of multiple personality of Chris Sizemore, who we'll talk about later, who actually ended up having 23 different personalities or something like that. There's the recent movie, A Beautiful Mind, about John Forbes Nash, who is a Nobel Prize winner, was it, who developed paranoid schizophrenia. The idea was in each of these cases that these unusual people were studied in detail to try to learn more about what might be the causes and to generate sort of ideas about that. In contrast, single case designs are attempts within one individual to demonstrate a cause and effect kind of relationship. And there are 2 major single case designs. One is the reversal design, also called the withdrawal design, or an ABAB. The idea here is that you measure something sort of at a baseline, the A condition, and then you do your intervention, which is the B condition, and then you withdraw the intervention again and go back to the baseline conditions and see if the behavior goes back to where it was, and then you introduce the intervention again. And if you can see that, I made up an example of this. During the 4, let's suppose you've been asked to develop an intervention program for a child who seems to have a great deal of difficulty paying attention in class. And this child, in the first 4 days of observation, is attending only around 20% of the time, a little more one day, a little less the other time, and is doing other things, disrupting the class, and requiring lots of time and attention from the teacher to get back oriented on task. And you decide that you think what's going on is that the child is actually getting rewarded or reinforced for being inattentive, and so you train and instruct the teacher to very carefully give positive attention to the child when the child is on task, doing what they're supposed to, and praises the child. Or you could be very systematic about it and have a counter on the child's desk, and the child gets a point for every 2 minutes of being attentive to what's going on, and can cash those points in after class for some kind of candy or something like that, so that you have a reward system going on for being attentive. And what you find is, in the next 4 days of observation, that the percentage of time that the child is on task climbs to a much higher rate. Now you could say, well, look, I've demonstrated that I can reinforce the child's attention, and the reinforcement is the causal agent. But somebody could say, well, maybe the kid just got used to the class. He's finally getting interested in what you're doing or something like that. And it just happened that this occurred during those 4 days of observation. You say, well, though, let's demonstrate that the reinforcement had something to do with it. So you go back to the conditions where the child is not being reinforced for attention, and the child again attends less and less over those 4 days. Then you reintroduce the reinforcement intervention, and you get the change back to a higher level of attention. You are, by the fact that you're putting the intervention in, taking it away, and putting it back in. And you could, of course, do this another. It could be an AB, 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 AB if you wanted to. You're trying to demonstrate that it isn't just the passage of time. It's in fact your intervention that's producing the change in the child's behavior. Now, an alternative to this is the multiple baseline, and here the idea is simply that you're doing it in multiple situations. Suppose you have the same child in 3 different classes, and for the first week you observe that in all 3 of those classes the child is relatively inattentive. So what you do then is put your intervention in the first class. So in the red line, you get between week and 1-2, you get an improvement in attention in that class, but not in the other 2 classes. Between week 2 and week 3, you continue the reinforcement program in class A, you introduce it in class B, and you get an improvement of the behavior in class B also, but it's still not improved in class C. And then for between weeks 3 and 4, you introduce it for class C as well. And the idea here again is that you're showing that it isn't just the passage of time, it is the fact that you've introduced it, the intervention in each of the 3 different situations. So you can again demonstrate make a case for having a cause and effect relationship by using multiple baselines. Okay, there are certainly other kind of methodologies. We've talked about things like twin studies and other genetic studies and such, but these are kind of the main things that we will run across as we talk about different kinds of psychopathologies. I want to switch now and start talking about anxiety generally, and then I'll get into talking about the anxiety disorders. Anxiety is a relatively universal experience. We all experience anxiety to some extent in anticipation of dangers or perceived dangers. It's an adaptive emotion. It facilitates coping with danger. We normally think of anxiety as producing a fight or flight response. That is, to some danger, our physiology is excited, it's raised, our blood pressure goes up, our attention is focused, etc., and we become prepared to fight if necessary, or flee or run if that's the better strategy. Actually, you can think of anxiety as a sequence of responses to potential danger. The idea of you can also be inhibited by anxiety, the frozen with fear kind of response, the deer in the headlight, is an initial phase of this sequence. Literally, the deer in the headlight is sensing danger or potential danger and is freezing and inhibited from moving as the deer is trying to figure out what's going on and what the best response is. And if the deer realizes that it's a car coming, then the fight or flight stage of running is sort of kicks in and is the next stage of the anxious, the fearful behavior. So there are both excitatory and inhibitory systems that are involved in anxiety, as I think your chapter talks about the behavioral inhibition systems and behavioral activation systems. Different parts of the nervous system. You got sympathetic arousal and parasympathetic inhibition in this kind of anxious response. There are behavioral aspects as well. We're talking partly about physiological components of depression. Obviously, there are behavioral implications. The fight or flight responses. Anxiety tends to enhance performance to a degree. It enhances simple tasks and simple performance. Anxiety may interfere with more complex performances, and you can actually determine kind of a curve where performance with a certain amount of anxiety on simple tasks, your anxiety will facilitate your performance. On medium complex tasks, it may facilitate performance to a certain degree and then interfere. And if you're having to do some really complex task, anxiety is likely to interfere. If you're doing complex math problems, being anxious when you're taking the test is likely to interfere with your performance. If you're preparing for the long jump, a little bit of anxiety and tension is often thought to be good because it's going to facilitate your performance on something simple like jumping. Clearly, there are also cognitive aspects having to do with your belief about danger, your belief about your resources and your coping abilities, and particularly when we get into different kinds of pathological anxiety, these play an important component. Some would argue that the anxiety disorders are sort of evolution gone wrong, that this adaptive mechanism that we have of dealing with danger was very helpful 10,000 years ago. If the danger was encountering a tiger in the jungle as you hunt and gather, but it may not be as adaptive when the dangers are on the mistakes you might make on the job, or the threats of disapproval by your boss, or that sort of thing. We can think of anxiety in different ways. We can think of anxiety as being either a state or a trait. Anxiety as a state is a temporary condition. Everyone experiences states of anxiety. If I said, please take out a piece of paper for a pop quiz, you might find yourself in a state of anxiety at the moment. Anxiety as a trait is a more enduring characteristic of the person. Some people are more anxious than others. Ordinarily, some people are more prone to anxiety reactions. They're more conditionable. They're more likely to experience anxiety in a wide variety of situations. And there are anxiety scales of both kinds. There are state trait anxiety scales that measure either your current state or your general tendency towards anxiety. We can also think of anxiety as being either specific or generalized. You can have anxiety about very specific things, particularly when we talk about phobias. A phobia is anxiety or fear of some very specific kind of object. Or anxiety can be very generalized. It can occur in many situations. Social anxieties may be very generalized, so that anytime you're interacting with other people, that may be anxiety provoking. Anxiety also, particularly when we start talking in terms of the diagnostic system, anxiety can be seen as a symptom or as a syndrome. As anxiety is a symptom of many disorders. Many disorders may have a component of being of anxiety. Most people who are depressed also experience a certain amount of anxiety. Many people who develop schizophrenia or other disorders, somatoform disorders we'll talk about later, may have show the symptoms of anxiety. But anxiety as a syndrome is a constellation, a pattern of anxiety symptoms that hold together. To say that somebody has the syndrome of generalized anxiety disorder or of obsessive compulsive disorder suggests that there's a particular set of anxiety symptoms that person demonstrates. The biological aspect, again, of anxiety may have to do with people's reactivity, their response, amplitude and duration to anxiety-provoking stimuli. There may be individual differences, and we may think of some disorders as being sort of a dysregulation, a disruption of biological reactivity. Panic attacks are intense anxiety attacks that seem to come out of the blue, and some people argue that this is a dysregulation, again, an anxiety system sort of gone wrong. In biological sort of paradigm approach, in terms of treatment, anxiolytic drugs, anxiety-treating drugs are common: Valium, Xanax, other such medications. From a psychodynamic point of view, anxiety is a symptom of repression failing. That is, that some undesired impulse is gaining unconscious expression in some form. One of Freud's famous case studies was of little Hans. Little Hans was actually, Freud never saw little Hans. The case was described to him by the father. What had happened, and this was in Vienna in the 19th century, the little boy had witnessed an event in the street where a cart had turned over with a horse had fallen, and the horse had been injured, and they had to put the horse to sleep. And after that instance where they saw the horse in pain, little Hans was afraid of horses in other situations. Well, today we would think of that as a kind of conditioning experience, but for Freud, what it symbolized to little Hans was the overthrowing, and remember the Oedipal period. Little Hans was 3 or 4 years old, so he was in the Oedipal period, which Freud believed was the period where boys wanted to overthrow their fathers to compete with their mothers. The overthrowing of this big, powerful horse was symbolically the successful overthrowing of the father figure in Freud's beliefs, and so he felt that this was symbolically tapping into little Hans's desires to defeat his father. So Freud recommended to the father that he spend more time with his son, that he help his son to be like him and to do things with him, to help him get through the Oedipal period of identification with the father, so that he could safely no longer feel in competition. And so his father spent more time with him. Again, you could take the same case and say, well, maybe his father was being with him, helping him feel more relaxed as they walked around the town and were exposed to horses, etc. But from Freud's point of view, it was the unconscious wish that was coming out as the anxiety and fear. I've slipped there into talking a little bit about behavioral models. Behavioral models consider anxiety as a conditioned response, and I talked about fear conditioning with dogs or other with animal kinds of models. One of the concepts when you think of conditioned anxiety is the idea of a gradient. And you can have spatial gradients, that is, if you've conditioned fear to some object, then the closer that you get to it, the stronger the fear. So you have a gradient of increased fear as you approach the object. You can also have a temporal gradient. If you have examination anxiety, then the closer you come to the time for the exam, the more your anxiety increases. And you can also think of thematic gradients. If you're afraid of snakes, then at the top of your gradient would be a large live snake, but maybe a picture of a snake or a toy snake might raise lesser amounts of fear, and you could imagine a gradient of different things along this theme of how snake-like they actually are. Now, here's another one of my technical achievements as a diagram here. This is a rat, if you can recognize that as a rat, in a runway, and the rat is hungry, runs around the runway, and at the right end there is a food box, and the rat discovers that they can get food there. So after a few trials of putting the rat in the runway, the rat will run rapidly to the other end and get the food. And the closer the rat gets to the food, the stronger will be the gradient, which was demonstrated there, of approach, the strength of the rat's motivation to move forwards. And when people were doing studies like this back in the probably 50s and 60s, they actually did things like tie strain gauges to the tail of the rat to see how hard the rat would pull to get toward the food, to demonstrate that there was a gradient there. Okay, well, that's an approach gradient. You can do a similar thing if now you put a shock grid down there. The rat, when it explores the runway, discovers that there's a shock if they get down to the end, and therefore will avoid that end, stay away from it, and you'll have an avoidance gradient. Note that avoidance gradients tend to be steeper than approach gradients, which leads to then our being able to develop a model of conflict. This is an approach avoidance conflict. Here, the rat in the alley will start out, has had experience that there's food at the end, will get to this point, will be more and more motivated to get to the food, will get to this point, and although is still motivated by the food, starts to be motivated to go the other direction by the avoidance gradient, and we'll get to the point where the avoidance tendency and the approach tendency are the same. And if it goes forward towards the food, the shock avoidance will keep the animal from going further, and the animal will go back, and what you get is an animal who will oscillate at that point of equal gradients. We'll want to go forward, but then we'll be afraid and we'll go back. Imagine the little boy who's been sent to the dentist's office for the filling and gets to the door of the dentist's office and knows that the toothache will go away and wants to get that taken care of, but hears the sound of the drill inside and remembers how painful that can be and oscillates at the door. Should I go in and experience that pain? Should I go in and get my toothache taken care of? It's an approach avoidant conflict. Now, this gradient model is George Miller's model of conflict. Talks about different types of conflict. You can also have in this instance, you could have an approach conflict. I'm at Baskin Robbins, and over here is the chocolate chip, and over here is the butter pecan. Which one am I going to get? Well, since they're both approaches, that's very easily resolved, because as soon as you start to go to one, the approach gradient is greater than, oh, that butter pecan looks really great, I'll have that. You could have, you have a question?
Is it supposed to show up what you're drawing?
Oh, is it not? They're not showing it. Scott, I'm doing a drawing here on the tablet. Okay, so that's an approach conflict. Which one do I want? You could use the same diagram for an avoidance conflict. Again, I don't want to go in the door to the dentist's office and get my tooth drilled. On the other hand, I don't want to go back out to the car where mother's waiting and she'd be mad at me if I didn't keep my dentist appointment. Out of the frying pan into the fire is an avoidance kind of conflict. You could also have a double approach avoidance conflict, which is typical of many conflicts in life. Do I want to go to the mountains for my vacation? Skiing, I enjoy the mountains, but that's very expensive. Or do I want to go to the beach? That's less expensive, but if I go to the beach, my relatives live there and I'll have to spend some time with them, and I don't enjoy that. So you've got two choices, both of which have pros and cons, and you're trying to make a decision between those. I'm sorry? That's a double approach avoidance conflict. I can have approach, avoidance. Approach avoidance was the first one, or the double approach avoidance. Well, let me talk about this. Systematic desensitization is a treatment for anxiety, where you establish a gradient of you establish what the avoidance gradient is. You create a state incompatible with anxiety, and then you gradually expose the person to this gradient from the lesser amount to greater amount. The most cited case in all of psychology is the Watson and Rayner and Mary Cover Jones, little Albert and little Peter. Watson and Rayner. Watson was the father of behaviorism, and he and his graduate student Rayner wanted to demonstrate that phobias could be conditioned. And so they got little Albert, who was the son of an assistant at Johns Hopkins University, and they tried to establish a fear. They presented a small furry animal to little Albert, and as they did so, one of them would be standing right behind little Albert with two big iron bars and clang them together and make a large, scary noise, so that the presentation of the animal was paired with the startling, frightening noise, and they demonstrated that they could create a fear of the animal, and that this generalized to some extent to other similar objects. Well, they planned then to do desensitization. Unfortunately, little Albert's mother got a different job and withdrew little Albert from the study. For many decades, people searched for little Albert to find out if he was lying on an analyst's couch somewhere as an adult, trying to figure out the childhood trauma that produced his fear of furry little animals, or whether it went away or whatever happened, but no one's ever found little Albert. Mary Cover Jones, who was actually, as an undergraduate, was Rayner's roommate, was able to complete the study. She was at Columbia and was in touch with Watson and Rayner, had Watson on her dissertation committee. And in her training clinic, where she was doing some training, a case, little Peter, was presented of a little boy who had a fear, much like little Albert's, of small furry animals. So Mary Cover Jones was able to do the desensitization experiment. Little Peter liked to eat. He was happy when he was eating, so they figured that that was a state incompatible with anxiety, and when little Peter was having lunch, they would introduce at the door, at a distance, a spatial gradient, the furry animal, and as he became comfortable, presumably counter-conditioned the little bit of anxiety caused by the distant animal, they brought it closer and closer along the gradient and did graded exposure. Just as an aside, the irony of all of this, Watson divorced his wife and married Rayner, a graduate student, and was fired from Johns Hopkins for this scandalous behavior. Today, they're known for this experiment. You could never go to Human Subjects Review Board at any university and say, we think what we'd like to do is really scare some little 4-year-old child and prove that we could produce a phobia in him, and then we think we could probably make it go away again. An IRB, an Institutional Review Board, would sort of never pass that today. But divorcing a wife and marrying a graduate student, most universities wouldn't bat an eye. So it's kind of an ironic sort of twist to the story. There's the idea of anxiety as a conditioned response, sort of behavioral approach has gotten a lot of mileage out of that. It's a useful way of thinking about fears, and desensitization turns out to be an effective kind of treatment. There are other exposure treatments that have been developed. But there are problems with this model. There are problems with the idea of phobias as conditioned responses. Number one, Watson and Rayner aside, it's really fairly difficult to produce something that looks like a real phobia in the laboratory. You can show people slides of something and shock them or whatever, the conditions that you would think would create a phobia, and you can do it. You can get a skin response reaction or whatever, but it's fairly difficult to do, and typically it requires many trials to establish the fear. Yet actual acquisitions in real life often are not like that. It's very typical to establish a fear or phobia in a single trial. All you need is one instance of the horse falling over in the street to develop the fear of horses, or to be knocked down by a dog, in order to acquire those kinds of fears. It's also actual phobias. Probably only 20% of them have a traumatic event. Most fears and phobias may have indirect acquisitions. Lots of people are afraid of snakes and cockroaches, but it's not because you were attacked by a cockroach or by a snake. You learn that those fears from other people. So you can have indirect acquisitions and also delayed acquisitions. Sometimes you're in a fearful situation, and it's only later that you start to be phobic about the particular situation. Conditioning would also predict that every object would be equally conditionable. You ought to be able to pair a snake with an electric shock, or pair a picture of a flower with an electric shock, or virtually any object. This is the equipotentiality principle, that every object has this as an equal potential for being conditioned. But it's just not tenable. It doesn't work. You can easily prove that some things are, you can condition fears to some things more easily than to others. Again, snakes, quick, small animals, animals with lots of feet, things like that. There are certain characteristics that seem to, we acquire fears more easily to some things than to others. I think I gave the example the other day of amongst children, you see lots of fears of animals, of dogs or whatever, but the equipotentiality idea would suggest that you ought to have lots of door phobias if children get their fingers pinched in a door, which also happens frequently, but you just never see a door phobia. The distribution of human fears is not consistent with the idea of conditioning. We are more likely to be fearful of some things than the other. And this is the concept of preparedness. And I don't remember whether I have, yes. This has to do with prepared learning. Prepared learning is the idea that evolution has prepared us to make certain kinds of associations more readily than others. And I want to make it clear here that this doesn't mean that these are innate fears. We're not born with the fears. We're born with the potential to learn some fears more rapidly than others. I don't know if you've ever seen pictures of small children, 1-year-old, playing with a snake. Small children aren't afraid of snakes. They're interesting animals like any other little animal that you might introduce to a small child. It's only after children have learned that snakes are scary somehow that they show fear to a fear of snakes. For some kinds of pairings, conditioning is rapid. It may only take one event. You can have conditioning without direct pairing. There's a taste aversion is an example of a fear that you shouldn't acquire by conditioning concepts. Martin Seligman, who wrote about this concept of preparedness, gave the example of what he referred to in an article once as the sauce béarnaise syndrome. He'd never had a béarnaise sauce before, and one night had a béarnaise sauce on his steak or whatever it was for dinner, and a couple hours later he was sick to his stomach. And ever since then, he can't go anywhere near a béarnaise sauce. It makes him stomach upset just to think about a béarnaise sauce. My own personal example is walnuts. When I was a child, I really liked walnuts, and one time when I was probably 5 or 6, I sat down with a big bag of walnuts and ate far too many of them and was sick later. And today I can tolerate a walnut, but it's really not my favorite kind of nut. But I developed a taste aversion. For many years I would avoid walnuts at almost any cost. Now, think of that in terms of conditioning terms. Think of, here you have Watson and Rayner, who are presenting the furry animal, and at the precise moment they're clanging the bars to pair these two together. And they're doing it very precisely because they know that you have to pair things exactly if you're going to get conditioning in the laboratory. But here, not in the laboratory, you've been presented with the novel stimulus, the béarnaise sauce, and 2 hours later you get the clang, the upset stomach, and you immediately make the association after one trial. That's a very highly prepared kind of learning. You can imagine that there's adaptive evolutionary value to having a novel taste, and if you get sick later, you stay away from that. If you found some new kinds of berries in the forest and you tried them and they made you sick, it would be a good idea from an evolutionary standpoint to stay away from those berries in the future. So evolution, the idea is, has prepared us to make certain kinds of pairings. I gave you the rat in the alley with the electric shock. Well, for animals, pairing pain with a place is an effective kind of learning. Animals will learn to stay away from a place where they got an electric shock fairly quickly. But if you try to pair the shock with some more abstract concept, you won't be able to get the pairing as well. Place and pain is an adaptive kind of pairing again. So we seem to be prepared to be afraid of small animals of various sorts, things that may have natural possible dangers, heights, the dark, lightning, small enclosures, etc. We seem to learn to be anxious about those situations much more easily. Sue Meinecke, a psychologist at Northwestern, who was actually initially a student of Seligman's, has done a number of very elegant studies of this idea. She was working actually for a while, first at Wisconsin and the primate laboratory there, and was demonstrating that you can teach a monkey a fear. And monkeys will learn fears from observing other monkeys. So she had things like, she actually did videotapes. And she'd have a videotape of where the naive young monkey sees a picture of a snake and then sees a picture of an adult monkey, a videotape of an adult monkey behaving fearfully, and the young monkey will develop a fear of snakes that you can demonstrate in other situations by that kind of observation. But if you take the same tape and put in a picture of a flower instead of the snake, you won't get fear conditioning. Baby monkeys can't figure out why anybody would be afraid of a flower, again, to anthropomorphize. But one kind of fear, they're ready to make the connection. In the other situation, they're not ready to make the connection. Then she's done this in all sorts of other ways. She has another setup where you have monkeys in two cages facing each other, and then you have a place in between where you can place an object that can be seen, it looks like, from both sides, but actually there's a mirror on the young monkey's side. So you put a snake on this side, and the older monkey over here with experience will behave fearfully, and if you have a banana out there, will not go reach over the snake for the banana. If you have the young monkey seeing the snake, the young monkey will behave in the same way and won't reach for the banana. But if you put the mirror there so that what the young monkey sees is again a bunny or a flower or some other object that we don't usually associate fear with, the small monkey will sort of not be able to figure out what's going on and will go ahead and reach out and get the banana. You can actually show the same sorts of things with human conditioning. One of the interesting studies that she did was have volunteer undergraduates look at pictures of snakes and paired that with shock, and you can get again, with enough trials, you can get a skin conductance reaction to the snakes. She paired shocks with pictures of frayed electric cords, things that now logically would be more associated, and in modern life you might be better being afraid of a frayed electric cord than of a snake, which you're not likely to run into very often in Houston. And she could get the conditioning to the pictures of the snake, but not to the pictures of electric cords. Again, it's a matter of degree. You might be able to get a little bit of conditioning. But she's demonstrating that it's an evolutionary set that we have to establish to be ready to fear certain kinds of things.
Wouldn't you really shouldn't you really be more afraid of the snake, since it's something you can't control, whereas a frayed wire, you know how to handle that. You turn off the power or move the wire with the stick or whatever it is, but you can't control the snake. And that's probably why you get the fear from the snake instead of the wire.
Yeah, but there are lots of, one of the other things about these fears is that distinctions are easily lost. Now, if you were actually growing up somewhere where there were lots of snakes around, the adaptive thing would be to learn which ones are dangerous and which ones are not. Which one can you go and pick up and toss out of your yard or whatever, and which one should you stay away from? And you should learn to make those distinctions. But one aspect of this is those distinctions are easily lost. Prepared fears generalize widely, so that any snake produces the anxiety. And the issue of controllability is certainly in there, and it has to do with a lot of fears. But you could probably control a non-poisonous snake just as much as you can control an electric wire. So yeah, and it may be that that's one of the qualities. Things that are that move quickly, which would be part of not being able to control, tend to be the kind of animals that we're more likely to be afraid of. Lizards, for example, people develop fears of lizards. Serpent-like things. Evolutionary prepared learning, prepared conditioning tends to, again, occur rapidly. It occurs without direct pairing. Distinctions are easily lost. And extinction is highly situational. If you're going to overcome these fears, it's difficult to do. You may have to desensitize the person to a variety of different things that they're afraid of. Lots of different pictures of different kinds of snakes. Perhaps do the conditioning, the desensitization in different situations. And all of this, Meinecke talks about this as evolutionary conservatism. You're erring. Evolution is making us err in the safe, conservative direction. It's from an evolutionary point of view good to learn to be afraid of dangerous things quickly. It's good to not require direct pairing, to be able to make distinctions of associations of one thing that happened and a consequence somewhat later. It's safer to be afraid of all snakes than to say, gee, I've never seen that kind of snake. That's probably okay. Better to be afraid of the novel snake as well. And it's safer to have those fears be resistant to extinction, last, and only get rid of them after many different trials of discovering that you're safe in the situation. From a behavioral point of view, one other point I want to make is that anxiety may be directly rewarded or reinforced. Anxious behavior often is reinforced by other people. People are sympathetic. They let you avoid something if you say you're afraid of it. There's the psychodynamic idea of secondary gain, which means that after you've acquired a fear for some reason, it may get you out of situations that you don't like, and there may be some secondary gain that's reinforcing in the situation. From a cognitive perspective, again, assessments of danger, resources available, coping, etc., and there are models of how we cognitively assess dangers. How dangerous do we perceive the situation? How capable are we of dealing with the situation? And control and helplessness becomes very important in terms of these perceptions. Well, let me start talking about the anxiety disorders. These are the categories of anxiety disorder within the DSM, the Diagnostic and Statistical Manual of the American Psychiatric Association. And the first category of anxiety disorder are the specific phobias. This term, incidentally, is a newer term, specific phobia. It used to be in the DSM-3, it was simple phobia, and people decided that that was demeaning. Oh, you have a simple phobia. It's like it's an easy disorder or some such thing. So it was changed to specific phobia. Specific phobias, again, are of various particular objects or things or situations. And there are subtypes of specific phobia. I'll have them listed here. And this is one of the places where the DSM actually used research to make distinctions. These subtypes are different in the typical age of onset, the typical course that they follow, whether or not they are aggregate in families. Do they tend to be, if one person in a family shows it, does another person show it? And in treatment response, they have similar as a treatment. So these categories, 4 plus other, are distinguishable in this way. Animal phobias, again, are snakes, dogs, insects. Typically are childhood onset disorders. You don't usually acquire a fear of dogs or snakes when you're 20 or 30 years old. If you didn't have it before that, you typically acquire it as a child. These phobias are much more frequent in women than in men, in girls than in boys. Estimates as high as 95% of animal phobias being in women. This probably has to do with some degree with socialization. Little boys are supposed to be brave and go grab the snake and scare their sister with it or something like that. Little girls are allowed to be fearful of animals. I once saw a woman who had an ant phobia, to the degree that I can remember seeing her as she's walking down the street, coming up to my office. She would walk a few paces and she'd stop and check her shoes to make sure that she hadn't picked up an ant accidentally. And even though my office was on the 6th floor, I had a big black leather chair in my office at the time, and that was bothersome because you can't see ants on black leather very well. So she'd sort of, before she sat down, she'd look closely at the chair and kind of wipe it off to make sure there weren't any ants on it, even though I hadn't seen an ant on the 6th floor in quite some time. It was an interesting fear. She did not have a particularly traumatic experience with ants. She'd just always been afraid of ants, and somehow the fear while it had been there since childhood, had gotten worse in recent years. It was upsetting to the family. She was so afraid of ants and of attracting ants that anything that would attract ants was not allowed in the house, namely food. So the family had to eat all of their meals in restaurants, and she wouldn't allow any food in the house. Now, there may have been some secondary gain going on there, and actually I had a sense that this was a marriage that was not the happiest, although on the surface it seemed to be okay. But I had the feeling that it may have been partly secondary gain that annoyed her husband, and that was reinforcing, possibly. In any case, we did exposure treatments to images of ants and had her imagine ant scenarios of various sorts with increasing on a gradient of how threatening the ants were. The next type is a natural environment. These, again, are fairly common. Heights, fear of water or storms. Also more frequent amongst women than men, but not at quite the range. Estimates from 55 to 70% women. Typically childhood onset as well, often with traumatic onset. When I was at the University of Pittsburgh, I saw a case that I will talk about in the next lecture of a fairly severe fear of heights. Questions or comments? All right, let's take a break and then we'll come back to talk about phobias.